Hello and welcome to our webinar. Before we begin, we would like to introduce ourselves. We are with the Louisiana State Public Health Department. My name is Rachel and I'm a healthcare ethicist.
And my name is Elena, a healthcare quality analyst. We are excited to have you here with us today, and we hope that we can explain why the Louisiana Medical Residency Exchange Program, or LEMREP, is important for both your institutions of higher learning and the public health of this great state of Louisiana. For our talking points today, we will start with an overview of LEMREP and why there is a need to address the health of incarcerated individuals, with input by Dr. Rotnick, a professional in the field. Lastly, we will discuss why this program is important to you and how your participation can contribute to the health of thousands of individuals, and we will close with a question and answer session.
The Louisiana Medical Residency Exchange Program is a coalition between the federal government, the Louisiana State Prison System, the Louisiana State Public Health Department, and Louisiana Public Institutions of Higher Education. We'd like to begin by explaining our motive in creating this program. This program strives to improve the health of incarcerated individuals by minimizing the many health disparities between prisoners and the general population, while also educating well-rounded and culturally competent physicians. According to the Bureau of Justice Statistics, there are currently 39,710 prisoners in 9 correctional facilities in Louisiana, making it the state with the highest imprisonment rate.
As a public health department, we cannot allow these almost 40,000 individuals to simply be swept aside in our healthcare delivery system. That is where you, as academic medical center board members, come into play. We would like this program to be integrated into your medical school's residency curriculum so that our future physicians can make an immediate impact on the incarceration crisis as well as be long-term advocates for vulnerable populations. In exchange for completing 3 months of residency within our correctional system, the federal government will forgive up to 50% of the participants' federal loans taken out for med school, depending on the individual's financial needs.
This program is an attempt to decrease the health disparities between incarcerated and non-incarcerated individuals. There is an abundance of research to suggest that prisoners do not receive adequate health care, which is in direct opposition to the 8th Amendment, guaranteeing the right to health for all incarcerated populations. For example, in a 2012 CDC report, 3.5% of the incarcerated population had HIV, whereas only 0.42% of the U.S. population was diagnosed with the disease. In 2005, 56% of state prison inmates had a mental health problem, while only 11% of the U.S. population presented a mental health disorder, according to the Bureau of Justice Statistics. Many of these disparities are due to the high cost of emergency care for incarcerated populations and the denial of essential medications.
Most often, these are rural communities far from any medical care facilities. When an inmate requires immediate medical attention, they are taken to an emergency room, which requires transportation to the facility and escort by 2 or more correctional officers. The location of rural prisons adds to the difficulty in acquiring necessary medications for inmates. By increasing inpatient services within correctional facilities, the cost of emergency care is reduced and the necessary medications are readily available. We believe that this program will address the gap in health care for incarcerated populations by increasing the quality of care. Now we would like to invite Dr. Rotnick, an experienced physician and advocate for improvement of health care in the correctional system, to tell us how an increased presence of physicians will benefit our stakeholders.
Here's the advantage of doing if you could engage a residency program. You can get residents under the practice of the attending. You can get more bodies in a facility, likely at a comparable cost to bringing in somebody on their own, okay? So you're getting more people in there to do, so you can increase capacity if you have resident docs there as well. Does that make sense? Mm-hmm. The other thing you're doing is you could be bringing in the CQI, the quality programs, engaged with residency programs now, because most residency programs, and I know family medicine definitely has this, where residents have to do a quality improvement project and they have to do a process improvement project as part of their 3-year residency. So by bringing in those kind of resources into a practice setting like a jail, you'd be addressing issues of quality and practice and bringing students and residents in. You possibly can do it more cheaply by having more people there, and that's not always a done deal. But the other thing is you're bringing in university resources, including research projects, other things to improve quality care. The other one, which is huge, is when you bring in an academic health center, you're bringing in young physicians and evidence-based driven practices that will reduce litigation rates.
With your participation, we would like to get at least 50% of the AMCs in Louisiana to participate in LEMREP, so that we can work together to mitigate the previously mentioned health disparities. Not only will your physicians be advocating for the health needs of a very vulnerable population, but also you as AMCs will be upholding the values and social justice initiatives that foster an environment of prosperity, inclusivity, and acknowledgement of human dignity.
Although incarcerated individuals have been punished by our legal system, that does not take away their right to efficient and high-quality health care. The Hippocratic Oath supports the belief that all patients ought to be treated with dignity and respect, without discrimination based on lifestyle choices. Additionally, the Hippocratic Oath enforces the idea that physicians are treating people rather than a disease. As AMCs, you are obligated to foster a learning environment for your physicians that reinforces these values of medical practice. You are also called to use your resources, capabilities, and vast pool of knowledge to give back to the community that you serve and educate. LEMREP hopes to be a vector for your participation in the betterment of communities in Louisiana.
If you would like to become a partner with the Louisiana Medical Residency Exchange Program, we invite you to visit our website at www.lmrep.gov. There you will find more information about the actual content of the residency rotation, as well as an FAQ section about the program and application process. We encourage you to submit the AMC application by May 1st, 2017, in order to be considered for the 2017-2018 academic year. Thank you for your time and consideration. We look forward to fostering fulfilling and empowering partnerships with all of your institutions for the improvement of public health and the betterment of our state. Now we will open up the floor for any questions that you may have.